Imagine the eye as a camera that must focus light perfectly to create a clear picture. In myopia, this camera system is slightly off, and that small error changes everything. The pathophysiology of myopia begins when light rays enter the eye through the cornea and lens, just like in a normal eye. However, instead of being focused precisely on the retina, something inside the eye causes light to bend more than it should. This is where the problem starts. In most cases of myopia, the eyeball is longer than normal from front to back. Because of this increased length, light rays traveling inside the eye meet too early. In some people, the eyeball length is normal, but the cornea or lens is too curved and has excessive focusing power. In both situations, the result is the same. Light converges before it reaches the retina. Once the light focuses in front of the retina, it begins to spread out again. By the time this unfocused light reaches the retina, the image has already lost its sharpness. The retina is designed to receive a focused image, so when it receives a blurred one, it cannot create a clear visual signal. This is why distant objects appear unclear in a person with myopia. The retina then sends this blurred information to the brain through the optic nerve. The brain does not correct this error. It simply interprets what it receives, resulting in blurry distance vision. Near objects, however, appear clear because their light rays naturally focus closer to the retina, even in a myopic eye. When a person with myopia tries to see distant objects clearly, the eye muscles attempt to adjust the lens through accommodation. However, accommodation cannot fix an eyeball that is too long or a cornea that bends light too strongly. This constant effort leads to eye strain and headaches, especially during prolonged distance viewing. In simple terms, the entire pathophysiology of myopia comes down to one concept: light focuses in front of the retina instead of on it. Once you understand this sequence, the symptoms, diagnosis, and treatment of myopia all make perfect sense.